If your hearing test says conductive or sensorineural hearing loss, you nodded like you understood. Don't worry. Most people don't. Confusing these two can lead to the wrong expectations, the wrong treatment options, and really a lot of unnecessary fear and frustration. My name is Dario Coletta. I'm a doctor of audiology, and I've helped hundreds of people to achieve better hearing and solve complex cases of hearing loss. And today, we're going to debunk this common myth with facts, not fear. I think the first thing we have to understand is hearing loss isn't a single condition. Now, the term hearing loss alone is more of a description rather than a diagnosis. Now, there's two most common types of hearing loss. We have conductive hearing loss and sensorineural hearing loss. They may sound similar to you, but they're actually very different. Now, I think it's important before we deep dive into what does a conductive hearing loss mean and what does a sensorineural hearing loss mean, I think we have to take a couple of steps backwards and first understand what happens with our ear, make the process of hearing happen. Now, we have our ear, or a model of our ear, and our ear is really broken down into three sections. We have our outer ear, which this consists of our pinna. Now, our pinna is actually really important because it helps to funnel sound into our ear canal, which is this section here. Now, both our pinna and our ear canal are what form our outer ear. Our eardrum, which is this thin membrane, followed by the acicula chain. So this is the malleus, the incus, and the stapes, which are three tiny bones behind our eardrum that form our acicula chain. Now, if we think back to grade school or high school, the malleus, the incus, and the stapes would have probably been called or referred to as the hammer, the anvil, and the stirrup. Now, our eustachian tube also is part of the middle ear, and that's helped to equalize the pressure on either side of our eardrum. Now, our inner ear is this section back here. So this is going to obtain this coiled area, which is the cochlea, which is often referred to as the hearing organ. And in here is a fluid-filled space that has inner and outer hair cells. We'll kind of come back to these in just a minute. We also have our semicircular canals, which help with balance. And then we also have the auditory nerve, which is going to send signals to the brain. Now, when we think back to the ear, or how we hear, there's a couple of really important steps. Now, sound, that actually starts as sound energy, and those are pressure waves in air. So our pinna helps to collect and funnel these sounds into our ear canal. As that sound travels down the ear canal, it's going to vibrate the eardrum, creating this mechanical energy. The vibrations of our eardrums are then going to move the three bones behind our eardrum, the malleus, the incus, and the stapes. These bones act like a lever system, boosting the vibration. The stapes is going to push against the oval window in the inner ear. Something to keep in mind, because of that size difference between our larger eardrum and our smaller bones, that mechanical energy is really concentrated but also amplified. And that's really important for the next step, because our middle ear is an air-filled space. Whereas when we move into our inner ear with our cochlea, that's a fluid-filled space. Air is lighter, fluid is more dense. So as those vibrations enter our cochlea, which is this fluid-filled space, the hair cells in our cochlea bend, creating these electrical signals. These signals then travel down our auditory nerve to the brain. And so this mechanical energy from the middle ear then becomes electrical energy in the inner ear. And this is actually the moment where hearing happens. So sound starts as energy in the air. It becomes a mechanical vibration in the ear and ends as an electrical signal our brain understands as sound. I think that's pretty amazing. So what is a conductive hearing loss. A conductive hearing loss happens when sound can't efficiently or effectively get to the inner ear. And so that either happens as a blockage within our outer ear, so our pinna or our ear canal, or within the middle ear space, including our eardrum, our tiny bones, the incus, the malleus, and the stapes, or our eustachian tube. I almost want you to think about this as like a blockage in a pipeline. Now, common causes of conductive hearing loss. The first one, wax buildup. I think it's important to keep in mind that not all earwax is going to result in a conductive hearing loss. I tell people all the time, having some wax is very normal and healthy to have. Wax only needs to be removed if we have concerns that it's blocking your ear canal or it's creating any pain or discomfort for you. Let's look at an amount of wax that actually did have an impact on somebody's hearing. And maybe if it helps, let's go over an example. We're back to our ear canal. As we look at, we have now earwax in the ear canal. And so one of the things we can see is this wax is completely blocking the ear canal, which will prevent sound from being able to pass through. This would be what we would call occluding earwax. Now, on the flip side, we still see we have earwax in the ear canal, but this is what we would call non-occluding cerumen or non-occluding earwax, where very normal to have, but we can see that the sound is still able to pass. Another common cause of conductive hearing loss is fluid behind the eardrum. And this is often something that we see with kids or pediatric populations based on their frequency of being sick, but also the configuration of their eustachian tube, which for children is generally more horizontal. And then as we get older, it becomes more vertical and is better able to drain. Ear infections, holes or perforated eardrums, like seen here, is also going to have an impact on our hearing abilities. And if we think back to the start of this video, our eardrum plays a really important role in taking sound and vibrating it across to the other parts of our ear. And so if there's a hole in our eardrum, that is going to change how our ear is able to effectively transfer sound beyond. And of course, middle ear bone problems, right? So we've talked a lot about the malleus, the incus, the stapes. And so for certain health conditions, one of those tiny bones can start to harden. And so then instead of acting like a lever system that's helping to carry sound, it becomes very rigid. Now, the key thing to know, the inner ear is usually working just fine. Sounds just aren't getting there properly. Now, the good news, conductive hearing losses are often temporary or medically treatable. So before we jump into seeing an example of a conductive hearing loss, I want us to take a look at an audiogram. Now on the left side, that is volume. And so that's going to be in decibels HL, decibels hearing threshold level. In the top left corner, those are extremely soft sounds. And then as we work our way to the bottom of that graph, those are very loud sounds. Now on the top axis, we have frequency measured in hertz. And on the top left, we are going from very low pitch sounds. And then as we work our way to the right, we are going to very high-pitched sounds. For the purposes of hearing tests, we generally measure from 250 hertz to 8,000 hertz, because that gives us a really good understanding of speech frequencies. Our cutoff for normal hearing is about 25 decibels, which is that light shaded gray area. Now, as an aside, I think one of the most important things is normal hearing is normal no matter our age. So if you have normal hearing, both the left ear and the right ear should be within that gray area. Now, one of the ways we're able to distinguish which is your right ear and which is your left ear in an audiogram is by symbol and color. So the red circles represent the hearing in your right ear. The blue X's, that's the hearing in your left ear. So I've walked you through an empty audiogram. One of the things I want to point out is, what does a normal hearing test look like? We can see that hearing is well within the normal range. If we look at a conductive hearing loss, one of the things we're going to start to see is the sounds that got played through the headphones. Now those are the circles and the X's. those are going to show some degree of hearing loss. Now, there's some brackets. When we do a hearing test, there's a piece that we put behind your ear, which is actually going through the bone. And so what we're doing is testing the better cochlea, because when we go through the bone, we're potentially going around any blockages within the ear. And so oftentimes with a true conductive hearing loss, we're going to see that the sounds that are played through the ear, so the red and circled X's, outside of the normal range, and then the bone is going to be in the normal range. And so when we see a large gap, we know that it's a conductive hearing loss. A sensorineural hearing loss, that's very different. This happens when there's either damage to the cochlea or the auditory nerve. Now, common causes include noise exposure, ototoxic medications, so medications that are known to potentially harm or damage our hearing. Genetics, head traumas, and sensorineural hearing loss is a permanent hearing loss. So it's a permanent change in our hearing. But here's the important part. It's not just about volume like a conductive hearing loss. Clarity, especially speech. That's why people say, I can hear you, but I can't understand you. Or I know people are talking, but they just sound muffled or they're not speaking clearly. So why does this difference matter so much? This is where things go wrong. A conductive hearing loss often improves with medical treatment and may not require hearing aids long term. Sensorineural hearing loss usually can't be medically reversed. It's best managed with hearing technology like hearing aids and ongoing care. If you treat conductive hearing loss like sensorineural hearing loss, you panic unnecessarily. The type of hearing loss determines the solution. Now, again, I'm going to show you another example of an audiogram. So just like the last set, our graph looks exactly the same in terms of the outline, but we can see our line looks a little bit different. And so for a sensorineural hearing loss, we can see that some of our hearing may be in the normal range and then slopes downwards, or it can all be within the hearing loss range. The difference is the sounds that played through the bone match up with the sounds that are played the headphones. And so when everything aligns, we know that this is a sensorineural or a permanent change in your hearing. Just to keep things interesting, some people have a mixed hearing loss. I'm sure you could have guessed it. It's a combination of both. This is exactly why online hearing tests fall short. DIY solutions, they often miss the mark. You can't Google your way out of this one. If you've been told you have a hearing loss, but nobody explained which type, that's a problem. Understanding your diagnosis is the first step towards protecting your hearing, your quality of life. If this video helped clear things up, like, subscribe, make sure you turn on the notifications, and share it with someone who just had a hearing test and probably left feeling a little bit confused. And remember, clarity starts with understanding. Let's cut the noise.